Hi everyone, how are we doing? Welcome to another episode of Let's Go Live. I'm coming to y'all today, this time, to talk about social prescribing. If you've seen the promo or the poster before, basically we're gonna have a guest today, Miss Gabe Palmer. She herself is a social prescriber. So basically, social prescribing is a new role that's in the NHS that I just think is so interesting. So we're gonna have Miss Gabe Palmer on today. I'm gonna add her to the live, and then we can get started. Hold on. I see her. Hold on, let me. Oof. Hopefully that. I'm trying to send her a request. All right, so I'm seeing Miss Palmer in the audience, but I'm not. I don't know if I sent her. Oh, there she is. All right, she's all up on her. Can you hear me now, Miss
Hello?
Palmer? Hi. Okay. All right. Great. I'm glad I can hear you. Okay. All right. Good. Yeah. So welcome to my live session here on my page. I just talk about different health topics with different health professionals. And again, for anyone just joining today, we're having Miss Gabe Palmer. She's a social prescriber. So we're just going to be talking about social prescribing, the new role in the NHS, and how it will impact the public health sector later on down the line. So first of all, Miss Gabe Palmer, just want you to give a little intro of yourself, like who you are, where you're from, and what you do, just for the audience.
Okay, so hi everyone, my name's Gay Palmer. Where do I start? I'm a daughter first, I'm a sister, I'm also a mom. I'm a nurse by background of 20 something years. Yes, I'm only 25, but yeah, 20 something years nursing background, but I'm currently a social prescriber. I've got two kids, I enjoy singing, so that's me kind of giving you the background of who I am.
Okay, all right, great. We're glad to hear that you're a dancer. We really do appreciate that. And you're a mom to two wonderful children. So just to jump in, what exactly is social prescribing? So you said you're a social prescriber. What is social prescribing really? What does it do? What's the role? What does it entail?
Sure. So social prescribing in a nutshell is where an individual support a person connecting them, and it could be with financial issues, it could be with looking for activities, it could be absolutely anything and everything that's non-medical. So it's more the practical, non-medical side of things. The terminology social prescribing, it does sound quite medical because it was actually doctors that coined that particular phrase. But you'll also find that social prescribers could also be known as link workers, care navigators, community connectors. So there's several names, but we're all doing exactly the same thing. But if I honestly describe what social prescribing is, I actually just say it's the art of a conversation with a person, understanding them, what they're about, what matters to them. So it's very much a personal approach. I don't tell them what they want. It's more about having a conversation and finding out what their needs are, and then ultimately identifying how we can best support them.
Okay, that's really interesting. So it's more of like a kind of holistic look of it. It's less of just a medical background of, all right, this thing is wrong with you. Here's some medications. More of a holistic lens on it.
Completely. None of us are prescribers.
Yeah.
They're just fortunate I happen to have a nursing background, but we have social prescribers who've got a law background, ex-veterans, people that worked in mental health, people that worked in the prison service. So it's nothing clinical. It's very much identifying what else or how else can we support a person. I'm very much about holistic approach because I'm not an illness. I'm not defined by a sickness. And to be fair, that's a very small portion of a person's life. So really wholeness and health and well-being is really important, looking at what makes them well or what promotes wellness. So that's the other side that we look at. We also realize that in research, we have the man himself, Sir Michael Marmot, who's done the wider determinants of health. And we recognize that for a lot of people, it's about 80% of their issues are non-medical. So it's great having medical professionals who do their part, but a lot of times it's not resolving the issues that people have. And this is where our roles have really tried to come in to support that.
Okay, that's actually really interesting. So what prompted the NHS, if for any Jamaicans watching, NHS basically is the National Health Service, which is the public health sector here in our public health service here in England. So what prompted the NHS to create this rule then?
Oh, let me just first give a shout out to all the Jamaicans. My parents are both Jamaican, so
Oh,
it's very
nice.
wrong if I.
We're
Yeah,
in the
yeah. So,
Jamaica.
my dad's from Hanover, mom's from Clarendon. So let me do that properly. Let me not disrespect
Clarendon.
anyone there. Let me do that
Big
first.
up Clarendon. Yeah, I'm from Clarendon. Clarendon, man.
Um,
Yeah.
so the reasons why the National Health Service brought social prescribing is ultimately um, the waiting times for a lot of the health services is significantly very, very kind of delayed. Um, Obviously, it was bad before the pandemic, and now it's even worse since. And they're realizing again there's shortages of many staff. So ultimately, there's lots of different problems, and there's just lots of people who need help and support. So they've then looked and said, okay, how else can we best support people? And this is where they've now brought in all the other additional roles. So from 2019, the NHS long-term plan said, okay, let's have a look at all the other additional roles that we can put within the service to try and ease some of the pressures. So social prescribing is one of the other additional roles. It includes community pharmacists, includes physiotherapists, paramedics, mental health practitioners. So all these new roles were added into the what we call the GP primary care teams to try and make it easier for people to be supported. So if the people can go to their GP, and if they've got a knee problem or joint problem, they can see a physio rather than seeing a GP. So it's just trying to make easier access for individuals. They've also just got high waiting lists because a lot of people are returning back into the system. And we're realizing a lot of times they're returning not necessarily because they're not, it's not their illness per se, it's other issues. So it's how can we try and prevent and reduce the reasons for readmissions? So it's usually, as I said, non-medical reasons. If someone's tripping and falling all the time, they don't really need a hospital. We need to review what's at home and how can we do things at home to support. So that's the reasons why the NHS has actually kind of put this kind of program in place. Social prescribing itself has probably been around for about 30, 40 years, but very much within the voluntary care sector. So the community services, a lot of the local organisations, local churches have actually been doing social prescribing for a lot longer than the NHS. It's just now the NHS has galvanised and really just kind of brought this more to the forefront and wanting everyone across the country within England, Scotland, Wales, and Ireland to actually have access to social prescribing. So trying to make it easier access for everyone.
Okay, that's actually really good. I think it's a very good initiative, and I think I can kind of relate to that in terms of like as soon as I moved to England, I realized that there's an issue with wait times. I find that as soon as you want to get anything, the wait time is so long, and basically if you get through to anyone now, you're basically gonna get an appointment down in like December or something. So the wait time is definitely an issue. So apart from that, then, what else do you think possibly is the most important factor, the most important effect of putting this rule into place?
It's allowing people that don't always access services to access the right teams of individuals. The idea is it's not always just about those who turn up to the practice. It's about how can we reach those who are sometimes deemed as the hard to reach. No one's hard to reach. You've just got to be able to go and find them. So we go to where people are and allowing them to understand what's available. We realize more and more is that people don't know what's actually out there. They don't know what they're entitled to. So this is now about us ensuring we can. It's about building the relationships and building communities as well. And as I said, health and wholeness isn't just about the physical body. It's also about the communities that are around us that can also promote that level of healthiness. So it's about the relationships, if I'm honest, relationships with the systems, but also the local communities where we're based as well.
Yeah, that is true. I think I can. You can find it. It's so easy to end up feeling lonely when it comes on to like the medical system and just trying to, especially if I mean, for me right now, I'm in my 20s. I live by myself. Sure, that's fine. No one cares about me. But like, if you're thinking about someone who's probably say 60 and they're living alone and they're not as used to technology, they're not as used to the advancements and so on. It can be so lonely and isolating for them to know what they can get, know what their benefits are, know what they can access to benefit them. So I definitely think that that's an important thing to try and build that relationship with the people that are coming through the NHS and coming for basically help, because you don't want to just be like, okay, you know, you're in the wrong department, you know, find your correct department. And then it's like, okay, sure, yes, find the correct department, but how do I do that, and what else could I try to access to benefit me better? So I definitely think that is a very important thing. um Question: do you think so far, well, I mean, you said that social prescribing has been in since about for about 30 or so on years, but with, I think, this recent kind of boom, I guess, in the role, have you seen it working any better towards its goals? For example, decreasing wait time or building that relationship with the patients?
Yeah, so I think ultimately the idea was there being an increase in social prescribers. And at the moment, I think we're sitting about 3.5, nearly 4,000 social prescribers since 2019. So the idea of galvanizing the workforce is already working. Um, Another key aspect of the role is about building the relationships, again, within the health system, but also within what we call the statutory services, like the local councils and the services that you can access there, but also the voluntary care sector. So it's about how we can work together. It's taking time, like with anything that's new. Um, the NHS is very well known for starting a lot of initiatives, and things can kind of get lost. And this is really about how can we make it more long term. So this is really about building those foundations, building the relationships, and making sure things are in place so that we can work really, really differently. It's taking time because, again, there's lots of people that need access to support and services. I've got to be honest, the volume I think is the part we weren't anticipating. So when I started in the first 6 months, we had about 600 referrals. And I work in an area that's got 18 GP practices, over 155,000 residents. So we're in Southwark, which is southeast London, and as a total of the whole area of Southwark, there's 350,000 residents that we're trying to support with a team of 30 social prescribers. So you can imagine that's a very large number. When we started in the team that I support in the south, we had just over 600 referrals. Last year to date, we had 3,700. So that's in 4 years. The volume of referrals has significantly increased. So that shows you very quickly that the level of need is there. What we're trying to do is then balance the capacity that we can manage, but also the services. It's great that we're there, but we need the services to be there so that we can make the referrals on and that people can be best supported. So it's trying to find a balance between all of us trying to do the same thing and work together.
Okay, yeah. I mean, I think it's one of those things where you kind of just start, so you kind of have to go through the mud and get it through. But that is shocking, especially for such a not small, but such a new and young team to just have to deal with a lot of as you said, the referrals, because that's like 1,000 odd per person to try and deal with. That is a
Yeah.
lot. But I mean, I guess over time the team will grow, and eventually it might start getting better. Um, with that in mind, hoping that it grows over time, what else do you see in store for social prescribing? Do you see it still kind of having that steady growth with all like basically chasing the number of referrals, or do you see the growth outshining the referrals? Do you see it going being a bigger deal internationally? Because to be quite fair, I've never really heard of it until I came here in England. So I'd actually love to see something like that blossoming internationally. Do you see that in store, or something like that in store for social prescribing?
Yeah. So social prescribing already has a global following. So we have around about 35 countries who are actually actively participating in social prescribing. So some of the key countries that are participating are Canada, New Zealand, Australia, parts of Spain, Nigeria. So the global idea, the global approach is very much being galvanized very quickly, because it's a way of helping people differently. As I said, I'm Caribbean background, I wasn't raised by my parents on their own. I was raised by a very large community of individuals.
Yeah.
There was doctors, there was nurses, there was teachers. So depending on what my need was, it wasn't always my mom and dad. It was an elder or someone else within the community that could help me. And we realized that anything that we faced in life, it wasn't just my parents. It was a family and a community that supported us. So the idea and principles of social prescribing have been around for many, many, many years. It's just taken a very different shape and form. It has the potential to grow, but like I said, it has to be with everyone working together.
Mm.
It's about ensuring we've got activities and resources and support. So all the referrals that are coming through, that's great, but we need people on the other side that can actually accept the referrals. And ultimately, it's about the money. I really
Yeah.
don't like having to talk about money, but I'm afraid it is. It's ensuring that every part of the system has access to the finance to ensure that we've got the activities that people can be referred through to, that we've made sure that we've got enough staff that are qualified and well skilled in being able to support individuals. So there's lots of different ways that it's growing.
Yeah.
It's now where we're at is in terms of how do we then get everyone on board. So as I said, we've got what we call the pillars of social prescribing. So we've got information and guidance. That's ensuring those who do legal advice, financial advice, ensuring we've got enough teams that can access, that we can easily access, but also trained and skilled individuals. It's how about then we work with employers, employees. Again, 'cause a lot of people are without jobs, facing difficulties. So again, it's ensuring that that side of people are there. We also have another side of social prescribing, which is what we call the green social prescribing. And again, that's very much to do with nature, gardens, greenery, ensuring that all those, ensuring the parks, the local communities, heritage sites, the museums, libraries, galleries, ensuring they're all involved. We have another part which is arts and culture. So again, that's ensuring that anything that's creative, and that could be absolutely anything. So that could include art, it could include paintwork, it could quilting, drumming, whatever that creativity is. It's ensuring that, and we have blue social prescribing, which is again is to do with the water related activities. So it's ensuring that all aspects of life and well-being is very much connected. What makes me happy is singing. So it's great that I can say that, I'm feeling down today, but I've got to ensure that we have enough resources for choirs and different spaces so that people have access to things that make them feel happier. So we're a work in progress. The beautiful thing about the global social prescribing is we're actually learning from each other really, really well. There's things they're already doing. I'm like, oh my gosh, I need to go nick that from Canada or nick that from, New Zealand. Not nick
But
it, borrow
yeah,
and share,
adopted.
borrow
Yeah.
and share. But again, it's that space where we can do a lot of learning. Throughout the year, we have a National Link Workers Day. We have Social Prescribing Day. We've got conferences this year again where we've got people globally coming in because it's very much something that people are very much wanting. It's something that the World Health Organization is also championing. It's something that the King himself, Prince Charles, also championed himself. King Charles, sorry, has also championed. So it's galvanizing the right people in the right spaces to say it's something that's really important. And to be fair, it needs all of us for it to work. There is no one that can't participate in social prescribing in some way, shape, or form. So it's really about raising the awareness, raising the knowledge, and just getting people on board in the best ways that we can.
Yeah, yeah, no, that's definitely important, and it's even so interesting that you brought up green social prescribing, because a while back I had a guest on, and he works in a garden, but he also says that sometimes he works with the garden, kind of works with like therapists as well. So you have some patients that I think there's a garden center in I think a hospital or something. He said, and the patients sometimes are brought into the garden center just for that therapeutic kind of vibe and just being amongst the plants and just to get them a bit more calm and a bit more mindful in their space, because they find that that does help, and I think it does help, and he said it does help as well. Him being a gardener, I don't think he was health professional really, but I think he just helped out with that in the garden center. But it was very interesting, and it's very interesting that you say that, because it just it just helps to show how everything ties together and how everything comes together as well.
Totally. And there's building evidence that we have as well in terms of the benefits of being out in green spaces, the benefits of gardening. We have a lot of creative practitioners. We have some of our local groups are art in the park. So again, they've got access to gardens, but it's in the park space. So again, they're using the greenery, the trees and everything else to actually create art. We have community gardens. We've got allotments. So there's very many different ways that, and that's what I'm saying, that's where we say health isn't just what is done in a hospital, or it's not the tablet per se. But if someone can go and join an activity where it's gardening, which is one, something they enjoy, the chances are they'll keep doing it. Two, it's also then connecting them with other people, which then kind of deals with the level of social isolation that people feel. It then helps people thinking, well, actually, I've done something really useful.
Yeah.
So again, it kind of builds their self-worth. It's even better if you can then grow your own vegetables and grow your own food and you can go home and cook it. So again, out of one activity, there are so many other benefits that starts to improve how you feel. We recognize, they say that social isolation is the equivalent of a heart attack or smoking 15 cigarettes. So ultimately, if people can actually do activities that can significantly change their physical well-being, the chances are it's not just the physical, but it's the mental and the emotional changes that people are also looking at. So there is an increasing level of research that is being done for the benefits of all these different types of activities. Music is a great therapy. It's used a lot for people that have come out of with long COVID. So it's looking at the respiratory side of things, but also for those who experience dementia. So again, is increased evidence saying it's the benefits of singing and how it changes how people feel. So that's the kind of beautiful thing. There is evidence that's increasing and the raising the awareness of the benefits. Mental health is significantly another area that is impacting absolutely everyone, and we're seeing that different activities, even young people, we're seeing the difference that activities are actually doing.
Yeah.
And it's improving their mental health. For a lot of people, they don't actually need a tablet.
Yeah. No,
You know,
it's so good that you say that as well, because exercise is such an important part of your general health. There was even this study done, and I keep bringing up this study. So if you if you're following me, you most likely heard this study already. But there's a study. I think it was called the Diabetes Prevention Program or something. But they did a study of about, let's say, 600 people, and they have them. All of them are pre-diabetic, and they have them based on one group that were taking metformin. And you're a nurse, so metformin is the go-to drug for diabetes. And then one other group was actually just intensive lifestyle change, so eating right, exercise. And it turns out that the metformin group actually had like a lowering of the blood glucose versus the intensive exercise group, because they found that you just need to change your lifestyle, you just need to exercise a bit more, you just need to eat more, and you can actually get yourself out of that pre-diabetes and probably just avoid it or lower your risk of getting some of these NCDs. I recently even did another episode of this with someone else, and it was basically on the topic preventing NCDs, and exercise obviously came up as a huge one, because exercise and eating right as well. It's not just exercise, but eating right as well definitely helps to get you focused and gets your body back on track, get your blood sugar sorted, blood pressure sorted as well. It is just one of those things, and we see it time and time again. And even as a pharmacist, when we were studying, I I think when we were studying hypertension, and basically when they were a certain stage of when the blood pressure was a certain stage, they were telling us, hey, you should really give them this medication, but if they're the type of person that will stick to a diet and stick to a exercise routine, you could just actually get that and get the same results, and get them out of hypertension. But obviously not everyone is like that, so most likely just have to give them the medication. But if a lot of people actually knew and believed and trusted that, you'd find a lot of people exercising more and eating right, just to get their body in a better shape and with less issues such as chronic diseases, as we are saying, and they find that they might not have to depend on medication as much as they do in most cases or some cases.
I think I totally agree with what you're saying. I think sometimes what's happened is depending on where you are and what you're advised,
Yeah,
you'll realise that our lifestyles are very busy and hectic.
yeah,
So everyone's looking for the quick fix. Everyone's what can I quickly do? Can I take a tablet to resolve? And I'm like, don't really need that. I'm a great believer the Most High created and designed us really, really well,
yeah.
and taught us that a lot of the hormones that make us feel happy, I don't actually have to eat the chocolate to do that. It's about the movement and X. Do you know what I mean? So we find we've put things in our place rather than doing the things that actually are the better things for
Yeah.
us. So generally, if you did exercise, they say 30 minutes every day. I might have to work a bit harder on that myself. Do you know what I mean? Having good connections, eating the right foods, you really don't need medication for some conditions. Also, there's a lot of side effects as well. And some people then stop taking medication. I'm like, well, is there some of the food that you could just change? So I think sometimes it's, especially the people that I speak to, it's about the balance of take the medication that's needed, but let's also look at the lifestyle. What can we do? The small changes that you can do and do different to ensure that you're longer term. Because what we're realizing is we're an aging population, we're living longer,
Yeah.
people are having long term conditions for longer. So if now it's really about is that going to be a tablet till I'm 102? Is there things that I can do in my lifestyle that can actually make me feel better? If I need the tablet, I need it. But are there things that I can be doing? Um, sorry,
No, that's
are there things that I can be doing differently? Is my one of my aunts 95 and she's on the farm first thing in the morning. She lives in Jamaica, that's why she can be on the farm at 5 o'clock in the morning. Do you know what I mean? She goes and does that. She goes to the market, then she looks after the chickens and the fowls when she comes home, and she makes me feel tired. And she's 95, and she's like, "Well, this is how I keep fit. This is how it's keeping me happy. It's keeping her active." And I'm like, that's the type of lifestyle that you need to have, something that you're doing things where you're enjoying, you're living life, you know what I mean? So there's so many different ways that living well can look different without the unnecessary use of medication and treatments.
Yeah, no, I completely agree. That's so true. Um, all right, so I think we went into social prescribing and what it is for a good while now. And it just sounds very, or well, as you can see, it's very tied around that holistic look on health, and it's not just the physical. It's not just okay, what symptoms you have. It's what's going on
Yeah.
otherwise in your life as well. That is also a good that's also the basis of health coaching. I'm not sure if you're
Mhm.
familiar with coaching. Basically, it's the same type of thing where it's like, okay, we have to look at the holistic health, and it's kind of like a bit of therapy and counseling as well tied into it. So I'm just wondering what is kind of like the difference between social prescribing and health coaching. Is there really a difference, or do you guys like work together in your field?
Okay. So I've got a health coaching qualification as well
Ah,
in all of what I do. Yeah, I just happen to have that one in. So the easiest way for me to kind of tell the difference between social prescribing and health coaching is, for me, the coaching is about the changes I want to make and giving strategies
okay.
and supporting a person. Do you know what I mean? So if someone's isolated, I will generally, if the social prescribing approach would be, why are you isolated? What can we do different? I want to find an activity. We help them find the activity. Once they're happy, that's them discharged. Coaching would be, okay, let's have the conversation. Let's go on the journey. Is there something else that's going on? I want to make changes, but don't know how. So again,
Yeah,
it's okay. Let's look at everything that's going on. Is there something emotionally that you're not looking at clearly? Can we change that differently? So it's kind of working step by step. I always kind of say the coaching is, it's looking at the process, the journey, changes that we can make. Whereas social prescribing has an element of that, but again, it's very much a shorter term in terms of, I found the activity you want to do. I wish you well. If you need us again, come back. Whereas coaching is looking at what significant differences. So we use coaches at the moment for long-term condition management.
Yeah.
So we have recently just done a hypertension group clinic, and we're starting to see the changes. Some people lost weight, some people have improved their eating and eating more fruit and vegetables. Now some of them have started to go exercising together. So that was looking at the different aspects and working with them in a slightly different way. So that's how I hope that's made sense.
Yeah.
The coaching for me is about the step by step, working with a person, strategies, tools, techniques. Social prescribing is more identifying the problem and finding the resource to support a person.
Yeah. Okay. So it's just mainly the approach and how we go about sorting out the holistic side of things.
Yeah.
Okay, that makes sense. Um, Earlier, I think you mentioned that you guys work closely with community pharmacists as well. That's in your group of people that you work with. How is it that you work with the pharmacists? Because in Jamaica, I think we're trained to be, well, at least as community pharmacists, we're trained to at least kind of be a bit of like health coaches in our little way. So it's like I look because in Jamaica a lot of people will come to us first, before they even go to doctors. They'll just come to us and ask something. So you just kind of have to be on the ball, know what advice to give them, know how to look at the non-pharmacological way, how they might be able to solve a problem before giving them the pharmacological way.
Yeah.
So how is it that you guys work with the pharmacists out here, the community pharmacists?
Okay. So we've got two teams of pharmacists. We've got ones that work within the GP practice, and then we've also got the community pharmacists that work within the actual chemists, pharmacists. So, for example, the ones in the practice, we actually do sessions together with them. So they may do long-term condition reviews. It might be diabetes reviews. They will look at, the weights, the food, and things like that. They will identify the needs, and that's where we then work with them to work with the community, kind of saying, okay, there's a food and dietary issue. Okay, is that a case of do we find local organisations that can help them, cooking on a budget or looking at healthy lifestyle? So we're trying to do that more. Something within the government in terms of the pharmacies here, they're looking at the issue of overprescribing, which is a major key issue. It is costing the system a lot of money, where people are being given not always unnecessarily. Sometimes they're given tablets by the GP. They go into hospital given another tablet, and then all of a sudden they don't need as many, but they're on them all the time. So we're looking at how can we reduce overprescribing. So again, as you said, it's now looking at, do you really need the tablet? Yes or no? Is there something that you could do different? Is it about your lifestyle? Is it about looking for activities? Is there something else that we can do? So we're looking at how we can reduce the use of medication. So we have what we call a lot of chronic pain
Yeah.
clinics that are actually social prescribed based. So again, it's someone who's facilitating, who is kind of understanding the pathway of pain and looking at mindfulness, looking at activities, looking at different things to actually reduce pain rather than going straight for the tablet. Or if they are on the tablet, it's looking at how can we reduce, not use it as often, use it more when really necessary rather than the first thing I'm going to go to is a pain medication. So that's how we're starting to work with the pharmacists differently, so that we can really kind of capture another aspect of the community. There's lots of people who, they're kind of like, I'm on the tablet and I don't feel any better. We're then saying, do you actually need to do an activity? Is there something else that you can do to make things different? We see really kind of significantly with mental health. You'll find that a lot of times within the clinical guidelines here in the UK, they do say that if you do need antidepressants, you actually need therapy to work alongside to really see the best effects of it. Unfortunately, we have significant waiting times. So for the therapy, so a lot of people are started on medication but don't get the therapy.
Yeah.
And therefore, by the time they have the therapy, they're a lot more worse, and therefore they need therapy for a longer period of time. So what we're then trying to say is, okay, are there activities or different ways we can engage these individuals while they're waiting? And for some people, they don't actually need the therapy by the time they're finished. They need an activity or needed to kind of be around other people, peer support, or go into different activities and groups. And for a lot of people, the concerns tend to come down.
Mm.
And then by the time they kind of get there, they're like, I don't need it now. They just needed something different. So that's the way that we're trying to work with the team, especially the pharmacist, what can we do to support a person rather than a tablet? Or if they need the tablet, what else can we do to improve just how they're feeling, and how best to manage life? I think a lot of people experience a lot of side effects, so it's a case of, okay, what can we do different in your lifestyle that can also kind of possibly just reduce some of the side effects as well, and ensuring that we can kind of just give the best to the person to kind of live a well life, rather than let's just give you all tablets and see how you get on, which clearly doesn't work.
Yeah, yeah. No, I definitely agree with that. Especially as you said with mental health, you just find that the tablets they take so long to give any effect anyway. So like even if it's actually working, it's wow to give the actual effect. I think it's like about 6 months. You have to keep telling them just hold on, just yeah, something's gonna happen eventually. Just wait. Yeah, I definitely do agree with that. And I feel like a lot of people, when you end up in that kind of condition where it's like, okay, you're on this thing that's gonna take like 6 months to work, and you haven't changed anything. You're just waiting on the tablet itself to give you an effect. After a while, it's gonna feel hopeless. You're gonna be like, well, then nothing's working for me,
Mhm.
and you don't change anything around you, waiting on this tablet, and then you start to get frustrated. Whereas if you probably get in contact with a social prescriber, and then they show you different resources that you can use to change an activity, or get started with an activity, talk to someone who's in your condition that you can relate to, and then get your mind kind of out of a certain place while at least you're on the medication, and also some resources to find therapy, or a resource that helps with finding the right therapist for you, because that's another thing to find a therapist. So yeah, 100%. So while we're on this, just to wrap up my last line of questioning, how does one become a social worker? How does one get into social prescribing? I think it sounds very interesting. I think a lot of people would want to get into that. So what, I guess, are the qualifications, and how does one get into it?
The greatest qualification, I think, is life experience.
Yeah,
As our team is very, very diverse. As I said, I've got a health background. That's my advantage. But it's not really about the clinical side of things. It's about, are you someone who can think creatively and differently?
yeah,
Um, are you someone who has kind of a get up and go attitude? Are you empathetic? Are you compassionate? Are you willing to listen to people and take the time and then try and find things to support them? Once you do find the role, then we do have qualifications that you can do, but it's not mandatory.
yeah.
Um,
Okay.
that is something that is being discussed. Do we want a professional accreditation, or do we want to, allow people? Because there's so many different ways that people get into it. Like I said, some people, they join an organisation and start it there. I said ours was in the NHS, so I went through the interview process, and things like that. So it's for me, those are the skills you need: the ability to listen, the life skills, understanding life, being willing to try, because for many people, they feel very helpless and hopeless by the time they come to you. So you've got to be able to have that kind of can do approach, the positive approach, going, okay, it's
Yeah,
not worked yet, but let's see what we can do. The ability to
yeah,
communicate, and communicate on several levels: one, with the local person you're speaking to, the local resident, but also with organizations, networking and building relationships with them, but also with some of the services, having some very difficult conversations with them about why your waiting times is awful. What can we do different? I have lots of patients complaining about your process. How can we work differently? So there's all that type of skill. So that's how I got into social prescribing, to be fair. It wasn't I kind of came out of one job looking for something different. I'd always said as a kid, I'm always going to be a nurse, and I'm always going to be a nurse. And my friend says, but you've got lots of transferable skills. And I was like, yeah,
yeah,
yeah. And she was like, try it. So again, there's lots of ways that people can transfer from other professions as well. I'm not saying you can't, but also you can transfer as long as you've got those type of skills. Like I said, we've got people who've got law degrees, we've got people that have been ex-veterans. So really different types of people can actually become a social prescriber.
yeah,
Lots of us have got extra skills. So I said I can sing, so Sometimes we may do singing or we may do breathing exercises. We've got some that do Zumba classes. So again, it's looking at what's the extra skills that you can bring to the table that can kind of improve how we engage and interact with people.
That does sound very interesting, actually. I might, if I ever fall out of my position, I might actually pay a visit to social prescribing. But it actually does sound like a good way, not just to help people, but also to help yourself as well. Because then, as you said, when you build that relationship, you get to do what you like as well. Because even you say you like singing, singing calms you down, and you get to do that in your. I think it's a very good role that NHS is, I think, investing their time and some money into for now.
Yeah.
So
My son
yeah,
doesn't even think I do a job. It's sometimes when I come home and I've done something really, he's like, are you sure you're working? I was like, I'm totally working. It's all a part of my job. And that's the beauty of social prescribing. It is so wide. Do you know what I mean? Today I can be helping someone with housing. Tomorrow I could be going to a creative arts group. Another day we could be talking about no 2 days are the same. I can be going to a local activity that does something with food and something else. So when I come home, it's like, are you sure you're actually working? I'm like, oh, I'm doing work in the most beautiful way ever. And I think that's what makes social prescribing really good as well. It is the variety. No 2 days are the same. You can specialize if you want to. So we've got two children and young people social prescribers that hone in specifically on children and young people. We've also got a housing specialist, so we've got opportunities to specialize in social prescribing as well. So it's got the potential to do a lot. It's literally going to come down to how we try and do that in the
yeah.
future.
Yeah, that's good. So if anyone in the audience wants to take up social prescribing, first of all, you can contact Gabe. She her is going to talk to her about anything else, but it's out there. It's something that you most likely would enjoy. So go and check it out. All right, we're gonna just go to the comments and see if there's any questions. I think I saw some questions in here for you, or probably like one. I see Regina saying hi. Hi, Regina. Thanks for coming. Um, Regina was saying community is very important. I think that was the time we were talking about community, which I definitely agree with. Casey Mastermind. So there's a question: what's the best anxiety technique to use once it's coming on? Is that something they could possibly help with or share resources for?
Sure. So again, it's looking at what's the trigger. Can we identify what's causing the anxiety? Is it a specific situation? So we always have that kind of conversation about what's happened, why we're at this point. For some people, it's about giving them the breathing techniques
Yeah.
while it's actually happening. How do we distract them out of that experience? Sometimes it's then a case of I know someone who there's a particular kind of hard boiled sweet that she sucks and actually literally moves her tongue around the sweet as a point of distraction, which
Okay.
actually helps to bring her down. So it's looking at ways of trying to bring the breathing down, get to the point of calmness. For some people, it's about mindfulness. For some people, it really does depend, to be honest. There's very many different ways. I said it's looking at the identifying what's the trigger,
Yeah.
what have you done before, what's not worked, how do you think it can be done differently? So we work with the person. We don't ever tell them what we think will work. It's a case of some people that have to try 2 or 3 things first and say that
Before.
one doesn't work. That's fine. We'll look for something else. So we always do that. We may offer resource in terms of signposting to videos or various things like that that really help them.
Yeah.
So as I said, it's about finding what works for the person rather than me going, here is it and it will work. It's working with the person and what works best for them.
Yeah. Because I mean, there's no really cookie cutter way to deal with mental health or just actually health in general. To be quite fair, with person to person, like it's gonna change. Even if it's slightly, it will change. So you might not have the same result each time. So if you're having for example, an anxiety attack, just know that if you see some tips online, you try it, doesn't work, you might have to try something else as well, just to see what distracts you, what pulls you down back into that control or so on, because again, it's not really a cookie cutter way sometimes, but you can try that and see if it works for you whenever that does come on or whenever you find yourself having
Mhm.
an episode. I think Casey again is saying that they started to use painting and colors to manage and draw away from what's going on. So, I mean, I guess if you have something like probably brush strokes, just like doing the brush stroke motion, maybe could help distract you when you're having like an anxiety episode or something like that. But I think those are pretty good activities to help just be mindful and to help you take your mind off certain things and just kind of help to lower the chances of you getting like an anxiety or panic attack in the future, I think.
Yeah, and it's about trying to bring someone back into the present moment and grounding, as they say. It's okay. It's something has made you feel that there is something significant about to occur, and it's how do we bring the person back into the
Yeah.
present? How do we bring them? Usually, that's usually breathing tends to be the best one to help, and then grounding them back to okay, you're in a safe space. You're not, there's no risk of harm. It's bringing it down. And there is a particular individual here in the UK where she went through significant mental health problems, various things with relationships, quite a significant family breakdown. She was seeing a psychiatrist who kind of said to her, "You're going to be on tablets for the rest of your life. You will not be working ever again." Probably not the best way to
I
communicate,
don't think
quite a bit
that's
honest with
the
you.
way to handle that. Yeah.
Wasn't great. And she sat in the waiting room a particular day and she saw a flyer for an art class. And she said, okay, let's go to the art class. Now we're 10, 12 years later. She's no longer on antidepressants, doesn't have to see the psychiatrist anymore. She's now working, she has her own business, and she now sells her artwork.
You see that something simple as that, just doing what you like, like it, and you can
Yeah,
tell like, probably something as simple as her not feeling as in control of her life, like in general.
yeah,
That's probably why she probably had a bit of spiraling happening, but then the art was a way for her to just be more grounded and in control and just express any creativity that she might have, and he went on to help her. That's a very good story, yeah, because and I mean, I'm no psychiatrist, but I mean, I don't think I'd tell I don't think I'd tell someone you can't work again. You're gonna be on pills for the rest of your life without even trying to
yeah.
refer them to someone who could possibly help otherwise as well. So that's that.
But it's also the
Um,
thing about, for me, illness is about a dis-ease. So there's something that is causing an imbalance within the physical body or the mental side of things. So it's looking at what things can I do to try and bring a balance back. Do you know what I mean? So that's how I kind of think, okay, there's something that's causing an imbalance. So sometimes it is a combination of things that will bring the balance back. It's not like it's not normally one thing for me. If my children are, you
yeah,
know, joyfully irritating me, sometimes I have to go for a walk
yeah,
or, you know what I mean, and do something that's a bit more calming. Or there's other times where I find going for a walk or go, do you know what I mean? So there's very different things, but all it's about is now about trying to bring a balance back to when something's out of balance. So I think I always say for health, it's about what's tilted me out and what can I do to bring it back into a
yeah,
balance. And health, as I said, I think this is sometimes where the perception of health is not great. The only time I need my GP is when something's gone wrong, or I need the hospital when it's gone wrong. Therefore, what can I do for the rest of my time to keep my health in check? It's exercise, it's what I eat, it's who I connect with. So many other ways, I'm very much my doctor's the last person I'm going to.
yeah,
I'm going to go to absolutely everybody, my mom, my dad, everyone, the pharmacist. So I don't have to go there because that is the end result. So if I can do things that improves how I feel within myself, mentally, physically, I won't have to see my GP at the end of it. Do you know what I mean? I can keep myself healthy and happy. How do I do that? It's people in my community that I connect with. My kids have family friends. Do you know what I mean? We see each other, we chat. We're in the park chatting together. Took my kid today, my daughter trampolining with her friends. Do you know what I mean? So there's lots of different ways to help bring a balance to who we are. And that part, the illness, is a small part, but how can we bring a happiness, which I think is a very important part of health, is happiness and the well being of it. It's bringing that back into balance as well.
Okay. Yeah, which makes so much sense because once you start spiraling out, that it's just like a domino effect. It just gets worse and worse and worse. So it's just all about bringing someone back to the center. Um, I think that though is very easy when you have someone there. This comment from Regina is basically asking how do you deal with a panic attack? Because she's saying she had a panic attack a few weeks ago, and it was one of her worst. But she had someone there, so she's wondering how do you probably try and go about it when you're by yourself. I imagine it's kind of similar with the whole trying to get like a breathing rhythm down, even when you're not having an attack, probably just trying to find a breathing rhythm so that if you have an attack, you probably can try doing that breathing rhythm. Do you think something like that would work for them?
Yeah, sometimes it's also really helpful to almost close your eyes. So whatever is distressing around you, sorry, keep trying to ring me.
No, that's
Whatever's distressing around you, it's trying to focus. So sometimes closing the eyes, and they actually say there's like a box breathing. So you kind of breathe in for four, hold for four, breathe out. Do you know what I mean? And then if you can keep going until, do you know what I mean? So it actually is trying to bring the breathing from a very short, shallow to and more regulated. It can take time, and it can take a few minutes, but it's persevering. Sometimes opening the window if it's too hot. Do you know what I mean? Just try and do things to bring yourself back into a space of centering. But like I said, box breathing usually is the one where you kind of literally breathe in, hold for four, breathe out for four, breathe in. Do you know what I mean? And then if you can go again, hold it for five, go for six until you actually feel that you are calm and centered. If you've got people around you that understand what you're going through, because sometimes not everyone understands what's actually happening. Again, if they can also support you to do that as well, to kind of bring you to a place of calm. If they don't, that's a bit difficult. That's trying to work with them until they get it. But if you've got people around, it's just really trying to help them support you, saying, this is what's happening. And it's about being calm and just trying to get them to a space where they can settle.
yeah,
Like I said, sometimes if you can kind of work out what the trigger is, it's possibly getting to a space where you can try and, stopping it before it kind of happens. I appreciate for some, it's very sudden
yeah,
and therefore it's kind of like quickly respond. But if you can kind of see what the trigger is, what can you do different to stop the triggers? Do you know what I mean? I'm aware it's happening. Do I move or do I not go there at a certain? Do you know what I mean? So whatever it is, try and looking at what the triggers are and see if you can deal with the trigger as well.
yeah. So I think that's really good advice. Just move away from the trigger, move to a quiet place too, because sometimes I think the noise it just doesn't help, and it just makes you panic even more. So yeah, close your eyes. Box breathing is very very good. I think I did make some videos with some mindful exercises that does involve box breathing, so I could send you guys that as well. Also, I did make a video on what to do if someone's having a panic attack, so I can send you guys that as well for tips. But thank you so much, Gabe Palmer, for joining us today. It was a really interesting chat. I just never even knew that social prescribing was around for so long, so I'm really glad that I could get to understanding a bit more. I'll definitely be looking more into it as well, but this I think was a good base of knowledge. So thank you again so much for joining us. I really do appreciate
You're
it.
very welcome. And if Jamaica wants to join, just let me know and I can connect you
That
with that. I'm sure Jamaica really does want to.
onto it because Jamaica just tends to
And if
yeah.
anybody wants to invite me and I'll come and I'll talk all about Salisbury in Jamaica, just please somebody pay for the flight. I'm more than happy to come and help you in Jamaica. But yeah, we've got connections here in the UK. If you want to kind of know and understand more about it, we're more than happy to support as well.
Yeah. All right, great. Thank you so much. And thank you, Casey and Regina, for participating. And thanks everyone else for joining. Yeah, we're gonna call it for this one. Have a great day, everyone, and have a great day, Miss Palmer. All right.
Take care. Thank you.